asymptomatic sites are being scheduled. We encourage you to get your child vaccinated at one of these publicly available sites or on-site at Boston Public Schools. While we are increasing supply, we must also increase demand. This past Saturday, we held a high-capacity vaccine clinic at Melnia Cass Recreational Complex. And I'm proud to say that we vaccinated 649 people. But we had the capacity to vaccinate 800 people. We believe that the Be Together initiative will increase demand for vaccination, and we will be ready to meet that increased demand. So I mentioned when I opened that this is a multi-layered, comprehensive strategy. Rapid antigen testing is an important aspect of our citywide plan. Starting today, rapid antigen test kits will be available for free at 14 sites throughout the city of Boston, at Boston Public Libraries, at Boston Centers for Youth and Families, and we are partnering with BHA, or Boston Housing Authority, and Boston Public Schools to make rapid antigen testing available for free to those who need them. I also want to mention that this particular policy is not instead of indoor vaccination. Our indoor mask mandate remains in place throughout Boston. Bracing for a new variant and dealing with a winter surge is certainly not what any of us hoped for. Though we are all tired and we are frustrated, I'm sure, we must continue to press forward to protect the health and well-being of ourselves, our families, and our communities. Please remember that all of our prevention strategies are important. Continue to wear masks indoors, wash your hands frequently, monitor yourself and your children for symptoms, get tested, get vaccinated, get boosted, and we will get through this together. Thank you.
Let's get through this together. We represent all of you. I want to applaud Mayor Wu, the City of Boston, for their leadership. That is what we need. I want to applaud all the municipal leaders, and I currently have been chairing the Metropolitan Mayor's Coalition now for a decade, 15 cities in the Metro Boston core. I speak for Somerville, along with my colleague, the Mayor-elect of Somerville, great leader, Tatiana Ballantyne, and we will be seeking Board of Health consideration of a similar measure in Somerville, as others will. You'll soon hear from a great municipal leader, Mayor Kim Driscoll, who with me, along with others, facilitated regional coalition calls, and along the way now for almost 3 years, we have been deliberate together, following the advice of epidemiologists, the highest level healthcare experts, researchers, because we had to fight for that information on our own. We need to continue to bond together and take this on. We need the state to step in and order these measures. We shouldn't have to fight for them. How many more lives do we have to lose? This is important. I know we're done with it, but it's not done with us. We can get there, and we know what works. And for those communities who don't have these measures in place, I want those residents to speak up louder than what you're hearing here and demand that be placed in your city and town. You demand it, because that's what you deserve. That is the core responsibility to what we should be doing in public office, is the health, well-being, safety, your lives, no matter who you are. God bless America's right for everybody. Let's keep everyone safe. Thank you.
50% of our young adults are vaccinated. 1 out of 2 people between the ages of 16 and 29 in my community and many others. Our hospitals have no wiggle room. Our hospital presidents have made that clear. In order to keep our businesses open, keep our communities safe, ensure that our kids can stay in school, we need to act collectively. Requiring a vaccine for entry into restaurants, fitness centers, entertainment venues is a small price to pay and a tool in our toolbox that we should be using to keep our communities safe, strong, and open. I'm proud to be here today, proud that we're going to act collectively. Know that there'll be many local leaders, local boards of health, volunteers who have been doing yeoman's work over the course of the last year, who are going to look at this action and collectively come together. Every city and town cares about the people who live there. Let's make sure we're using every tool in our toolbox to keep everybody healthy. Happy to be here, happy to support this.
Thank you, Mayor Driscoll. Next up is Brookline Select Board Member Raul Fernandez, the Huntington Theater. Good morning. The Huntington Theater Company requires vaccinations, thank you, for all of our staff and artists, and has been requiring masks and checking for proof of vaccination or negative COVID test of everyone entering our venues since we reopened for live indoor performances back in August. These vaccine checks have been going very smoothly, and our audiences have greatly appreciated these safety precautions. In fact, 50% of Boston's arts audiences have said that requiring masks and proof of vaccinations is the minimum level of safety protocols required for them to attend an indoor event. Thankfully, we know that the vaccination rate of our audience and of the Boston arts audience in general is very high. About 98% are vaccinated. We support Mayor Wu and the City of Boston's decision to require proof of vaccination.
Here and there, I want to start with one question that I've gotten several times already, which is why phase this in starting with just one dose instead of starting with 2 doses right up front. This is to ensure, the goal of this policy is to ensure that we are safe, and this is to increase vaccination rates. And so we need to give time for members of the public and for staff and the workforce at these businesses who will also be asked to show proof of vaccination to get vaccinated, to keep coming to work. And so this timeline allows for everyone to receive their first dose if they have not yet already, and then to get their second dose and phase it in as quickly as possible with the required time in between. I'll also mention, sorry, I see you, Charmin and Danny, also mention that Dr. Ojakutu and I will be hosting an Instagram Live this afternoon for members of the public who have questions, so you can follow us then. You can go to our Instagram and then ask questions live at that point as well. So for the media, Charmin. The question was around how the city will be supporting our small businesses with enforcement, especially given feedback about how sometimes challenging it can be to enforce the mask mandate already. So we've learned a tremendous amount from our partners in New York City and other places. Cities across the country are already implementing this, and once it gets to the point that it is part of the culture, part of the standard expectation, there's much less direct challenge in compliance. As we ramp this up, the city will ensure that we are providing the resources. We will have signs available to pass out to our small businesses or downloadable and printable from our website, daily webinars, and we will ensure that we are doing this in a way that supports ongoing efforts. This will happen with our Inspectional Services Department, not through any public safety agencies, and we will partner with restaurants to ensure that this is restaurants, gyms, businesses that this applies to, so this is smooth, and we are investing in the infrastructure to support compliance. So the question was on the city worker part of this and whether this needs to be negotiated and whether the test option should stay as an alternative to full vaccination. We are in conversations with all of our city unions to proceed along the processes that are required. As the initial policy was implemented that had both options, a similar process is underway for this update of the policy. We know that as cases go up, it is necessary to protect everyone who interacts with city government to have full vaccination among the workforce, to avoid any more outbreaks in our schools that could happen from unvaccinated teachers or staff in schools, to avoid any unnecessary transmission from city services. This is meant to keep each and every one of our city workers safe. And again, we are already at more than 90% of our workforce vaccinated. I'm confident that that number will continue to grow as we host on-site clinics in partnership with each of our departments. This is a requirement that will keep all of our workforce safe in City Hall and in the community. We are going to work in the coming weeks with each one of our city unions to arrive at the provisions that can be incorporated into contract negotiations, and in the meantime proceed in updating our policies, providing training, increasing access to boosters and to vaccination. But this will be a condition of employment for the City of Boston as it's phased in. In terms of restaurants and gyms and entertainment venues, similar to other cities, there will be a phased-in approach with a tremendous amount of outreach, of engagement, support, but we will be enforcing this with penalties and fines down the road for businesses who are not yet complying. But that is down the road as we work very, very hard to ensure we're in conversation and providing every resource possible. And I'll open this up to any of our other mayors or electeds. Yeah, I'll repeat it. The question was, in an issue that is divisive, how do we bring people together on this? Part of this, from the City of Boston's perspective, is doing this collectively and ensuring that we are taking the burden off of our local organizations and businesses who are having to make decisions on their own and face the consequences of having a patchwork out there. Consistency, clarity, and shifting the culture will help with that. I'll pass it on to Mayor Curtatone.
Just to add, I submit it's not the overwhelming majority of people we know, the polling, support this. In our community, I can attest with the business organizations we work with, between the Chamber of Commerce's, the local first businesses, the business welcomed in my own gym in spring on their own when you could wear a mask if you were fully vaccinated, put in a vaccine requirement, and people were proud to show that card. All right? The overwhelming majority of people want it. How do we deal with it? We need to be ethical about what is true, what we know, and why we're doing things, and engage, like Mayor Will was doing together, bringing broad-based coalitions within their community, which we have in Somerville, working everyone to understand how we roll out in a very practical, meaningful, and effective way, and communicate. Thank you.
Would any members of our COVID advisory committee want to weigh in on this question? We're good? Okay.
I just want to add that during this process, we've spent an enormous amount of time in community engagement. One part of that has been convening the COVID-19 Advisory Committee, which has a multidisciplinary group of individuals from multiple different sectors, and getting their input. And by and large, all of them were in favor of this move. Secondly, from the Boston Public Health Commission perspective, we've been having community meetings regularly to see what people think, to see if we're reaching the right people, to see what information they need to be able to implement this policy. So community engagement has really been central to this initiation.
The question was on the number of city workers who are on unpaid leave as of today. I don't have the exact numbers here, but we can definitely follow up, and we'll have that we'll share that by our Instagram live time. Yes. Okay, the first question was on major events like First Night and whether they will be affected. first night is an outdoors event, and so this policy only first it won't kick in until January 15th anyway in terms of first implementation. But outdoor events where people can safely space apart are not intended to ever be covered by a policy like this. At the point where outdoor dining will overlap with this, outdoor dining is not subject to any sort of proof of requirement, for example, anyway. So activities like that are outdoors are largely not covered. And then there was a question from the public, I believe, about how do we know that this will be effective, given that there are breakthrough cases, given that there are cases where testing happens and yet there are still continued cases, and will this be a barrier, particularly for communities of color? There are breakthrough cases. Vaccinations do not prevent every single case of COVID-19, but what we do know is that when you are vaccinated, you do not get nearly as serious a case of COVID. As was stated